the second hour. Ladies and gentlemen, for goodness sake, you're spending time with me, and I appreciate it. I appreciate your support. I appreciate your encouragement. I appreciate, most importantly, your spreading the word about what we are up to, because, quite frankly, in all humility, everybody needs to know what we need to know, and nobody knows what we know. This is why, in large part, Longevity was created, in order to provide a grassroots coalition of the informed, a grassroots network of people all around the world who have heard Dr. Wallach's message of health recovery through science-based, clinically verified medical nutrition, and who are telling everybody in their lives about it. Like Sue in Kansas. Let's go to Kansas and see what's up with Sue. Hey, Sue, thanks for the call. You are live.
Hi there. Thanks for taking my call. I have several people that I'm dealing with, and some good friends that have health issues, and I wanted to know what you would recommend giving them. One of them is, she is an epileptic, and she did have seizures for quite a few years, but then she went back to work full time, and she started having seizures again. So,
okay, so did the seizures develop when she was an infant or a child, or only later in her life?
After she was pregnant.
Oh, okay. So that's from our point of view, which we believe is correct. There are two reasons you can get seizures. One is the birth defect, in which part of the brain just isn't there. Part of the brain that should be there isn't there because it didn't develop, and people like that are going to have seizures for the rest of their lives, and they're going to need to be on seizure medication. But when people develop seizures later on in life, it's due to essential fatty acid deficiencies from our point of view most of the time. Excuse me. So the recommendation here for her, in order to support and promote the structure and function of her central nervous system, would be eliminate the 10 bad foods, eat a diet that's high in cholesterol. Interesting, right? Because her brain and her nerves are made from cholesterol, amongst other things. 75% of the nervous system, central nervous system, is made from cholesterol, so it's an extremely important nutrient for central nervous system function, cholesterol. And the recommendation for nutrient support would be one healthy brain and heart pack per 100 pounds of body weight per month. One healthy brain and heart pack per 100 pounds of body weight per month, because the brain and heart pack has extra essential fatty acids in it, extra EFAs in it, which are helpful when we are attempting to support neurological function. Make sense?
That makes total sense. Okay, and then the next one, I have two different friends that they've developed cancer, and one was a brain cancer, and it started to spread. He's gone through lots of different things, and every time he turns around, he gets cured, there's something else that pops up, it seems like. And then another one, it started out as lung cancer, but now it's spread and it's kind of dropping around here and there in her body.
Well, cancer is, illegal for anyone but an oncologist to treat. We can't treat cancer. We can't even, intimate that we treat cancer. But, however, there's a doctor in Texas. His name is Brzezinski. B like baby, U-R-Z like zebra, Y-N-S-K-I. B like baby, U-R-Z like zebra, Y-N-S-K-I. Okay. He has an alternative treatment for brain cancer, which is showing remarkable success. And if I had brain cancer, I may go and see him. In addition, of course, to giving my body proper nutritional support, because everybody's body needs proper nutritional support, which is not to be misconstrued with the cancer treatment, right?
Yeah, exactly.
Yeah, so the recommendation there is easy. It's the Healthy Brain and Heart Pack. One healthy brain and heart pack, and one selenium per 100 pounds of body weight per month, and as much Z-radical as the person can afford. One bottle a day would be a good place to start, plus eliminate the 10 bad foods. The same goes for anybody that's dealing, for the other person that has the other type of cancer, right, we need to support the immune system. And I would recommend doing that in the same way, but also by adding the immortalium to the program, as much as they can afford. Also, everybody that has a cancer diagnosis needs to get a copy of my book, The MD Emperor Has No Clothes. And that's available through my website. You can download it to your Kindle or to your computer for $9, I think, and 95 cents. Or if you want an old-fashioned paperback, it's $19. The MD Emperor Has No Clothes, very inexpensive. And in the book, which is just jam-packed with lots of very useful information, by the way, there's a chapter on cancer, and I have 10 questions that every cancer patient needs to ask their oncologist in the presence of a recording device and a witness. And as God is my witness, if every cancer patient asked every oncologist these 10 questions, politely, with a recording device and a witness, very few people would get on board with the MD's therapies. Because the MD's therapies for cancer don't cure cancer. They don't. 99% out of the time, they don't cure the cancer. They just manage the cancer, and they create boatloads of side effects into the bargain, and they're extremely expensive. So if most people just had an objective, third-party understanding of what the heck the cancer drug is going to do and what the goal of the treatment is, they wouldn't do the treatment. But nobody asks the MD oncologist these questions because everybody's frightened out of their freaking minds, and they're intimidated by all the technology that they're around and by the idiot in the white coat. I mean, it should be a law that, every cancer patient, every patient who's in a hospital setting has a patient's rights advocate that asks the doctor objective questions about the treatment and then acts as a go-between between the doctor and the patient, because it's not the doctor's job to cure the patient. It's the doctor's job to sell the treatment. You get it? It's the doctor's job to sell the treatment. And the oncologists are masters of selling the treatment. And people just need to get a clue and, cowboy up here, because cancer treatment in this country is a runaway train, and it's killing people and adding insult to injury, quite frankly. My mother was a perfect example. She died of chemotherapy from the treatment for ovarian cancer, and the treatment, which was never meant to be curative in the first place, completely altered her personality, and it completely sabotaged the last 24 months of her life, making it unbelievably unbearable, notwithstanding the diagnosis of the cancer. So I know of which I speak. Other than that, Sue, I don't know what to do.
Well, I think this will give him a good help, and I really appreciate that and everything that you do, and I very much enjoy listening to your show.
Oh, you're the greatest, Sue. I appreciate the kind words. It's always nice to hear a positive prop every now and then. Cleveland, hey, Cleveland. I have a funny story about Cleveland. Leon from Cleveland is up. Hey, Leon, thanks for the call. You are live.
Glad to speak with you. I'm also a former pharmaceutical salesperson.
Wow, well, all right, so let's do a double header. If you'd be willing to, I'd love to hear you talk about your experience with pharmaceutical sales. If you'd be willing to, on my radio show, I think people would like to hear that story.
Sure, I'd be glad to.
All right, Leon, you can give my producer your info when we're done talking. Thanks for the call. How can I help?
Well, I've been following what I call a fairly good diet, but not the gluten-free one, for many years, and I wound up with a cardiac arrhythmia.
Oh, yeah, isn't that a son of a gun, right?
Yeah, and I took your stuff, the glucogel, the curcumin, the cream, the ice pack, all that kind of stuff. Still hasn't done anything, although I think it's improved. But I have a high level of lead, arsenic, cadmium, mercury. Could that be contributing to the situation? Well,
that's an interesting thing to talk about. How do you know that you have high levels of lead, cadmium, and mercury?
Well, I had what's called a cardio ion test done that was like a 13-page report of my blood. It covered everything from you name it.
Okay, so the definitive diagnosis, so that can kind of get us into the ballpark, right, which is a good place to be. But from a purely scientific, objective, dry, clinical point of view, the best way to assess the levels of toxic metals in the body is with something called a 24-hour chelation urinary challenge test. So you have to take calcium, sodium, EDTA, or here's another pharmaceutical. It's going to spring to the front of my mind in a minute. Either way, you have to get an intravenous injection of calcium, sodium, EDTA, and then for the following 24 hours, you have to pee into a jug, and then you have to take a sample of that and send it to a lab in Illinois, and they will assess, in point of fact, how much of this crap is in your body. Because if there's a lion's share of it, then yes, it can be interfering with your recovery. But right, this stuff is either there or it's not there, right? So, and you have to, before we get on board with an aggressive get the metal out program, which is a little stressful to the human body and not that cheap either, you need to have it definitively know that it's there. And the test that you just did is not definitive. It's presumptive, and it gets us kind of into the ballpark, right? But you need to really know for sure. Now, regretfully, there aren't that many physicians in the world who know about this therapeutic intervention. However, there is a place that you can go. There's an organization called the Institute for Functional Medicine, IFM. Just do a Google search for Institute for Functional Medicine. And they offer some of the best training in the world to healthcare practitioners like MDs or osteopaths or naturopaths who already have a medical degree. And one of the things that they teach is the clinical assessment of heavy metal levels in the body. So any doctor or healthcare practitioner who has gone and completed the IFM coursework, postgraduate, will know how to assess this stuff in your body. And you can get, I think, a state-by-state listing of IFM doctors at their website. So that's what I would do first. But stick around, Leon. I have a little more advice about what you can do here. Let's pick it up after the break. I appreciate your call. More to come, folks. Welcome back, ladies and gentlemen. I always speak from experience, which I think is one of my strengths. And I've always said that we love nurses and we love pharmacists because pharmacists know more than doctors do about how the drugs work. Pharmacists know more than doctors do about how the drugs work. And quite frankly, if it were reversed and pharmacists had the power, I think the delivery of medicine might be a little different than it is. And if we put nurses, gave nurses power over doctors, I think things would be a little bit different too. We're speaking to an ex-pharmaceutical rep, right, who used to sell drugs for the pharmaceutical industry. He's got some stories to tell. He's been with us for a while and is trying to support and promote the structure and function of his central nervous system in this case because he's been dealing with arrhythmias. So, Leon, are you still with me?
Sure.
All right, very good. So how tall are you and how much do you weigh, Leon?
I'm 5'10" and weigh 185. My body mass index is 27, and I'm kind of surprised because I don't seem to have an ounce of fat on me. Yeah,
that's interesting, isn't it? Yeah. Okay. And you've eliminated the 10 bad foods?
No, I haven't.
All right. So that's why the arrhythmia is going away slowly rather than rapidly, right? And that's and I know that this just doesn't make sense, man. It just doesn't make sense, right? But you got to trust me here. And here's the rationale. You've heard it before, right? That the gluten protein that's found in wheat, barley, rye, and oats is a long chain of amino acids, and it's your body's job to split that chain up so that your intestinal tract can absorb the individual amino acids. That chain is really difficult, if not impossible, for your stomach acid to break up. So when you eat that food, it causes inflammation in the intestinal tract as the intestinal tract tries to suck up a big chain rather than an individual little amino acid. So, and it's kind of like, if you stub your toe, right, or get bit by a mosquito, it takes 10 seconds to get bit by the mosquito, not even, but the little mosquito bite is going to last for 2 or 3, 4 days. Well, when you eat a little bit of wheat, barley, rye, or oats, it's going to cause inflammation, but that inflammation is going to last inside the body for 3, 4, 5 days. And then you're going to eat something again, more inflammation, more inflammation, more inflammation, more inflammation. So the only time that medical nutrition fails is if you're not taking the right stuff or you're not absorbing what you're taking. So, in this case, believe it or not, the consistent consumption of wheat, barley, rye, or oats, even if it's a little bit, would have a deleterious effect on the absorption of the nutrients. So you may be taking a 200-pound dose, but because you haven't eliminated the 10 bad foods, you're maybe only absorbing, 50 pounds of it. I mean, I'm making numbers up here, but you get the idea, right?
Okay, yeah.
So that's what you got to do next, man. Just keep taking the same stuff, but no more wheat, barley, rye, or oats, and which is a lot easier to do than you think, because there's a million gluten-free products all over the place now. It's a million times easier to do this now than it was even 5 years ago.
I'm familiar with that.
Okay? So that's what you have to dial in.
One other quick question. Can you comment on metformin? My wife has A1C of +7. Her MD recommended she take metformin. Can you just give us a quick synopsis of what you think of it?
Well, metformin is not meant to fix the illness. Metformin is meant to manage the illness, right? From our point of view, type 2 diabetes is rooted in mineral deficiencies, specifically chromium and vanadium, plus the host of other weird little minerals that most people haven't even heard of. So if somebody has an illness that is in fact caused by not enough chromium or not enough vanadium, giving them a drug that's going to upregulate glucose metabolism is not going to fix the problem. It's similar to, taking a high blood pressure medication, right? The blood pressure medication is going to create a chemical vasodilation, which is going to reduce the blood pressure, but it's not going to get to the root cause of what caused the high blood pressure, which is not enough calcium and not enough magnesium. So it's better to take metformin to manage the sugar than to not take anything and suffer from high levels of sugar. But an even better strategy is to give your body the raw materials it needs to optimize its sugar metabolism. And so there's no harm and no foul in continuing to take metformin while she's giving her body mineral support and nutritional support, as long as she's measuring her blood sugars religiously. Because remember, the goal here is to get people so healthy that they don't need to take the drug. And that's not because we're against drugs. It's because we're against management rather than a fix. It's always better to fix the mold than just paint over the top of it. So, there's no harm and no foul in doing that, and while we're waiting for the medical nutrition to kick in. I hope that answered your question. Stick around, folks. More to come. Welcome back, everybody. Dr. Peter Glidden here, your steadfast advocate for health. Phone lines are going crazy. Let's talk to Dustin in Ontario about the 10 bad foods. Hey, Dustin, what's up?
Two questions, actually, Dr. Glidden. Just to let you know, I'm an insider. I'm about to buy your book. I got 4 Wallach's books. I'm in this head first. I'm a nutrition coach and a fitness clinician, so if you need anybody to talk about strength training ever, just give me a shout. But my sister's got a pretty bad problem right now. She had severe sciatica. She was in the hospital, paralyzed with pain. She's out now. She was going to get surgery, but she actually decided not to, so I'm really excited about that. But we know she needs to get on this stuff, but the budget thing is kind of a problem. So I'm not sure, what route to go, buy the traditional pack, or should I go more osteo with the glucogel, or what? I'm not really sure what the best idea is. So.
And what was the definitive diagnosis?
Oh, sciatica, but she got an MRI. It was bulge of the L5 and S1.
Oh, okay. So, this is an interesting thing to talk about, right? Just because there's a bulging disc does not necessarily mean that that's what's causing the problem. Because I got to tell you, I've seen patients that have had bulging discs and neurological problems, like sciatica or sciatica. They go in and they get the surgery, and the problem persists after the surgery. Because it was a coincidental occurrence, not a cause and effect occurrence, right? And sometimes it is in fact the bulging disc that's pressing on the nerve. So we don't want to really put the cart in front of the horse here. Also, you understand the anatomy, right? So when the sciatic nerve descends through the pelvis, into the leg, it's pancaked over by a bunch of muscles. And if the muscles that the sciatic nerve is pancaked by, as it descends into the leg through the pelvis, if those muscles are in spasm, then that's going to be also contributing to the sciatica. So the first, second, and third thing that I do with people that are suffering from sciatica is I give extra calcium, because muscles need calcium and magnesium to constrict and relax the way that nature intended them to. So with money being an issue here, the first thing that I would do for 30 days is aggressive calcium supplementation. And, if she can't afford the Healthy Start Pack, then I would give the Cal Toddy and the EFAs. I would give the Cal Toddy and the EFAs. I'd give 1 bottle of Cal Toddy per 100 pounds of body weight per month, 1 bottle of EFA plus per 100 pounds of body weight per month, and then 1 extra bottle of Cal Toddy.
Well, she really likes the osteo. I've been giving her mine, but you say the Cal Toddy still?
Well, money's an issue, right? Cal Toddy's less expensive than the osteo, so
okay, gotcha.
That's why, right? And it's got more magnesium in it, which in this case may be better for her if I'm right that it's a muscle thing and not a bulging disc thing, okay?
So you're saying she could be impinged, but that still might not be causing the pain. It could be just the muscle spasm, the piriformis or whatever. Yes,
and in the fact that the bulging disc, it's presumptively the cause. It's not definitively the cause of the sciatica, right?
Even if it's being impinged, it still could maybe not be the pain?
That's correct. It might not be. And I got to tell you, man, I've had patients that have had the back surgery for this, and it doesn't work. They're still in pain after the fact. Yeah. Now remember, right, everything, so the body's this really complicated system of interrelated parts, and, how is it that when somebody eats bad food and gets food poisoning, how is it that they get headaches? Or, nightmares, or weird things happening with their blood pressure, or fever, or chills, or not? How is it that these things all happen? And never the same for each person, but different for each person. How is it that these complex symptomatic expressions show up from the same cause, but they show up differently in different people? It's because, we got anatomy, we've also got physiology, and then we've got the whole schmear of complex interconnectedness. And, because money's an issue here, what I would do for 30 days to look to see is just go crazy with calcium and see if that gives her leverage. Now, it's either going to or it's not. And if it doesn't give any leverage, then what you want to do is the connective tissue support, right, for the intervertebral discs.
So the glucogel and back to the osteo kind of thing?
Yeah, well, you can stay with the Cal Toddy, but you just have to add the glucogel into the bargain here. And the most cost-effective way to do that, I believe, is with the capsules. Okay, and we dose that to support and promote healthy connective tissue structure and function at 1 cap per 10 pounds per day. But also, for this, if it is impingement, if you can find a chiropractor that has a decompression machine, a decompression table, maybe you'll know after 1 treatment. They have very sophisticated decompression tables now that they put people on. They're FDA approved here in the U.S. This is the real deal. This isn't some weird alternative therapeutic, right?
Oh, yeah.
And, they'll strap the person onto the table in a particular way depending on which disc they're trying to decompress or which vertebrae they're trying to decompress. And she'll know after 1 treatment whether or not that's the problem, because if it is, in fact, impingement due to the bulging disc, then a decompression treatment will provide symptomatic relief temporarily. The trouble is finding someone who has that machine and who knows how to use it, right?
Yeah, she did go to a chiro, and I'm not sure if they had that machine or not, but you're saying if they do have that machine and they do kind of give that traction and pull it apart and there's no relief, then it probably isn't the impingement then, right?
That's correct, yeah.
Okay, the other question about the 10 bad foods, I'm on board with pretty much the whole thing. Obviously the wheat, barley, rye, and oats, and I'm starting to buy into the oil thing too, but I'm assuming you're kind of being just, you're not trying to split hairs, you're trying to keep it simple, but as far as the dairy, the meats, I'm sure maybe your book you acknowledge it, but as far as the quality, as far as the grass-fed, as far as the omega-3 to 6 ratio kind of thing.
Yeah, you're 100% correct. I mean, you're 100% correct. And in a perfect world, if people are going to eat meat, then it would be prudent for them to, non-GMO fed cattle, grass-fed, over grain-fed. Absolutely, positively correct. But honestly, man,
it's not priority, I guess, right?
Well, no, it's not that. It's because this is medical nutrition for the masses, right? This is kind of broad brush strokes. Look, here's what you folks need to do in order to start to ease the stress of food on your body, ease the burden of that, and give your body nutritional support. And just with these 10, prohibitions, people give us a hard time.
Yeah, I hear you.
So adding, you can only eat meat if it's grass-fed, and you can only have stuff if it's non-GMO. People are going to just jump out of the boat. It's going to be too hard for most people to do. So, we bring people in slowly. And you're absolutely positively correct. I should have, the next level of bodily optimization once you're already in with the 10 bad foods and taking the 90 nutrients. You want to take it to the next level? Well, here's what we do. Eliminate, 11 to 20. Right, so we need to iterate another list. You're absolutely positively correct. But the reason that I didn't do that up front is just because I didn't want to scare people away.
Okay, I figured that was going to be your answer. One more tiny quick one. One more tiny question. I'm kind of confused about this, and Wallach's the man, but why the heck does he have a little belly on him? I mean, he's got all the nutrients. Why does he have a little belly on him? It just drives me crazy. Because
he doesn't exercise, and he doesn't do... he doesn't do abdominal stuff. And if you look at indigenous people around the world, right, people who are, in their 70s and 80s, as you get older, if you're not exercising, if you're not involved with, like active exercise like martial artists are, for example, then you're going to get a little bit of a belly as you get older, and that's a function of hormones. That's a function of hormones, and that's a natural thing to happen to the human body as you get older. And, you can get on the other side of that like Jack LaLanne did, right, by doing, being in the gym for an hour every day and working specific muscle groups. But Wallach, number one, doesn't have the time for that, and he doesn't have the desire to do that, and so that's why. So the formation of a gut in people that are grain-free as they get older is specifically related to hormones. And, this was one of the reasons that Suzanne Summers' book and that whole hormone supplementation craze that gripped the country for about 15 years, that's part of the reason. Because as you get older, your body stops the production of certain hormones naturally. It's not an illness. It's not a nutrient deficiency. It's simply a function of the aging process that even in a nutritionally optimized body, as you get older, certain hormones are going to be less prevalent. And as certain hormones are less prevalent in the body, physiological things are going to occur. And Suzanne Summers' whole thing was that you have to go against nature and give a 70-year-old body hormonal injections or hormonal supplementation to bring your hormone levels back to where they were when you were in your 40s, right? And
I got to train you guys, man. I'm in high-intensity training, Arthur Jones, MedX style. We do 20 minutes.
Yeah, well, look, so let's talk about it. So give the producer here your contact info, and I'll have you on the radio show, and we can enlighten the masses as to what they can do with exercise, because exercise with nutrition is Superman, right?
Absolutely.
Exercise without nutrition is suicide, right?
Yeah, agreed. Thanks for those questions. I will definitely give my email or whatever you want there.
All right, I appreciate you, Dustin. Thanks so much for the support and the kind words and, for the work that you've chosen to do in the world. Jessica from Pennsylvania is up next. I think she has a report. Hey, Jessica, thanks for the call back. You are live.
Yes, we spoke in April of this year, somewhere around November of 2013. All my nails turned dark.
Okay.
My finger tips, which I thought I had, frostbitten or something.
Oh, yeah.
They were, looking awful and black and whatever.
Yeah.
Pain in the joints, especially on my fingers. I will wake in the morning and I have to use my other hand to, put my finger out because it's like that.
Oh, you had like a locked trigger finger? You had to squeeze it out? Yeah, holy smokes.
Right. Mm-hmm. So I spoke with you. Before I did, my husband started taking the healthy pack, so I started doing that. And I spoke with you after that and taking the selenium, the EFA, RTQ, plant-derived mineral.
Yeah. So for 3 months now, is that right? So that was April, May, June, right? So you've been doing the stuff for...
fully 3 months because there was a lapse in the stuff, coming.
Oh, yeah, you had to order it, and it took a week or so to get it, right?
So
Yeah.
give and take maybe 2 weeks off.
Yeah.
So I'm going to tell you the good results first.
All right, well, I'm on the edge of my seat. What happened?
A simple thing as opening of a water bottle was difficult. I couldn't do that.
Now you can?
It pained so much. Going in my handbag, I couldn't do that. Yes, I can do that now. They are better, but the thing is, I don't know if I will be able to get rid of the color because it's discolored.
Well, all right, Jessica, hold on with me. We're up against the hard break. I really want to talk to you about this. So glad that you called. Stick around, please, and we'll dial this up after the end of this break. Stick around, folks. We're talking to Jessica. You're not going to want to miss this. Finishing out today's show, ladies and gentlemen. My, oh, my, how time flies when you're having fun. We're talking to Jessica in Pennsylvania. So your weak hands and painful hands got better, right?
Yes. It's not as bad. It's actually 90% better.
Great. Now what? So did anything else improve? Anything else?
Excuse me?
Anything else get better? Mood, energy, appetite, anything?
Yeah, you're talking about, looking seeds like butter, before, melting. Well, my fingernails, you can literally see the colors coming back.
Oh, that's great.
They're coming back in stripes, so they're actually coming back.
That's great.
So, I just want to tell you what I'm taking now. So, if I need to, up it a little bit, I'm taking 4 selenium a day, 2 ounces plant-derived mineral.
Whoa. Slow down. How much do you weigh?
I'm 142. They're about 5'8".
Okay. All right. 150 pounds. How many selenium are you taking?
I'm taking 4.
All right. So you need to do 9.
Okay. 2 ounce plant-derived mineral.
Perfect.
That's twice per day. 2 scoops thingy.
So you do 4 ounces a day or 1 ounce twice a day?
4 ounces a day. 2 ounces 2 times.
Of the plant-derived minerals?
Mm-hmm.
You can kick that back to 3 ounces a day if you want, and I'm fine with you staying at 4 ounces a day, no problem.
All right, 2 scoops thingy, 1 ounce of the osteo twice per day.
You need 3 scoops of the tangy.
Okay.
You need to do 1 scoop 3 times a day of the tangy. The EFA, 4 EFA is good. 6 would be better, but I'm okay with 4 EFA for you. 6 would be better.
And 2 RTQ.
Yeah, the Cell Shield RTQ you don't need. Do you suffer from allergies at all?
I do. My eyes, that's the only thing I'm not really seeing happening for my eyes. They're constantly red and itchy.
And is that seasonally, because of the springtime pollens, or is that 24/7?
No, that's like it will just disappear, comes back another week, and that's how it is. Doesn't matter the season.
All right, so when the eye symptom is present, do the eyes get watery or are they dry?
They're watery.
And when the eye symptom is present, does anything happen to the nose?
Yes. Sometimes
what happens to the nose?
Yes.
So you get runny nose?
Sometimes that happens, yes.
And is the stuff that comes out of your nose burny or is it bland?
No, it's bland.
All right, there's a homeopathic medicine you may benefit from in order to help with the eye symptoms, which we're assuming are allergic in nature. Have you ever taken a homeopathic before?
No.
All right. Well, at the health food store in the vitamin aisle, there's a plastic shelf with about 50 little homeopathic medicines dispensed. And the homeopathic medicine is in a small little blue tube. It looks kind of like a lipstick container. It's about the size of your pinky finger, right? More or less.
Okay.
It's a tiny little blue tube. And it costs maybe $10. And inside the tube is going to be about 100 little white medicated pellets. You want to find the homeopathic medicine that says euphrasia. Let me spell that for you. E like Edward, U, P like Peter, H like Harry, R-A, S like Sam, I-A. E-U-P-H-R-A-S-I-A, euphrasia.
Got it.
And then it will say O-F-F period, O-F-F period, euphrasia officinalis. And the 30C strength, 30 like 30, C like Charlie. Please take 2 pellets every 3 hours when the eyes are a problem. And after 5 doses of the euphrasia, if there is no significant change in the eye condition, you can stop it.
Okay.
Now, if you do take the euphrasia and there is a significant change in the eye condition, you want to stop taking the euphrasia and then start taking it again in the future if the eye condition comes back. You start and stop, start and stop, start and stop. It's either going to help you or not. You need to, now, having said that about the eye condition, my recommendation to you would be 12 EFAs a day, okay?
Okay.
Take 12 of the EFAs a day, and that should go a long way towards helping with this. And if you'd like to, you can take 4 of the Cell Shield RTQ a day. But I would rather see you do the 12 EFAs and the homeopathic euphrasia. You need to up the ante with the Beyond Tangy Tangerines, 3 scoops a day, and take 12 or 9 of the selenium a day, 9 of the selenium a day. You're good to go. Really, you need just more time here because since you've already experienced positive benefits, it's only a matter of time until the rest comes around, and we are out of time right now. Appreciate you folks. See you tomorrow. God willing, and the creek don't rise. Live long and prosper.